So this is an overall treatment for gastrocnemius and soleus, and we're using all the techniques we've covered so far, looking at effleurage, petrissage, soft tissue release techniques, NMT, and about how we bring those all together to make a decent sort of coherent treatment for a specific region. We're going to focus onto calves, but you could transfer and use the same techniques for hamstrings or quads, depending upon where you want to focus treatment. So as with all sports massage, the first thing we're going to start with is an effleurage stroke. So it's going to be a really gentle introduction to touch. It's going to spread lotion. It's going to gradually warm the tissues up. And it's also going to let me as a therapist palpate and work out where I'm going to focus my treatment as it progresses. So I'm always looking for areas of tension, be it medial, be it lateral, and that's where we're going to progress towards the deeper techniques when we feel the tissues are well warmed up. So with our effleurage, then our options could be a single reinforced technique. We could be using double-handed techniques, forearms, single-handed techniques. It would depend upon the size of the region that you're working. But it's a really core technique that spreads lotion, it gets blood flow moving, and the technique's always pushing back in line with venous return, but retaining contact all the way back, so we're not leaving the patient untouched throughout. Okay, so once we feel like we've got a bit of warmth in towards the tissues, we can then progress towards cross fibre work. So there's some tension in this medial gastroc, so I'm going to start moving towards some cross fibre techniques using my thenar eminence and also my palmar surface. Just small semicircles, but still going back in line with venous return, and really trying to work through the tissues, spreading tissues out, separating medial from lateral gastrocs. If the lateral gastroc head was tighter, we could do the same thing with my left hand, adding some internal rotation of the lower leg to bring that gastroc head out towards me, using my palmar surface around here. If I wanted to make it a bit deeper, I could use knuckles. So same movement and same direction, and then taking it cross fibre, but with a bit more pressure because I'm using my knuckles. I lose a bit of palpation through there because my knuckles aren't quite as sensitive as my finger pads or the palm of my hand, but it's a good way to get a bit more depth into the muscles that we're targeting. And the same on the lateral side. If it wanted to be really focused, I could use a thumb that's reinforced or finger pads, but for the purpose of this calf here, we'll just focus on knuckles and my palmar surface. Because that's quite deep, then we'll break that down with a bit more of a superficial technique, the open C, where we're lifting gastrocs up off soleus, just again to separate superficial from deep, and to put a bit of a stretch into the muscle belly. So upon palpation, we've got a broad area of tension in this medial gastroc head just here. So a good technique to treat that would be a muscle compression. So that's where we're putting sustained compression into the tissue, with the objective being to empty capillary beds, and also and get a fresh influx of blood back into the tissue, and also reduce tone by a process called inhibition. So I'm going to add a bit of internal rotation through the lower leg to bring that gastroc head towards me and ease of access, and then using the heel of my hand, I'm going to apply direct pressure into the muscle belly, and then when I think I've got to an appropriate depth, I'm going to hold it for 15 seconds. All the time listening to the tissues, are they relaxing? And listen to a patient to see if it's causing a degree of discomfort. And then after I've reached that sort of time period, slowly draw back out from the tissues. And again, you might well see an area of erythema, which indicates we're getting blood flow into whereabouts we want it to occur. For lateral tissues, same thing, same technique. I just move the limb into a bit of external rotation, a nice straight arm, so I'm looking at my posture and I haven't got too much extension through my wrist. Just drop the pressure in towards the tissue again. Same principle, same technique, but just a different position to give me better access into that gastroc. So because they're a bit tender, then remember it's always good to just shake the tissues out, give them a chance to relax, give your patient a bit of a break from more painful techniques. Or I could move into a gentle stretch in through gastrocs or soleus. This would be more soleus, but it would help just to get the tissue to relax a bit more and help to reorientate fibres when we go through them. Okay, so if we now think about trying to get a bit more deeper and also starting to mobilise soft tissues with a bit more pressure, next thing I'm going to do is reinforce my thumb and just run that up between gastroc. So right there in that intermuscular septum between medial and lateral gastrocs, and then continue that technique really quite nice and steadily, trying to encourage creep through collagen fibres, and then continue that movement till we get towards the proximal attachment on the posterior lateral and medial femoral condyles. So it's quite deep, it might cause a degree of discomfort, but it should be really quite nice and steady, so we're trying to stretch through the tissues that we're trying to elongate. I'll do that again, so thumb's nice and reinforced. Slowly move up between those two muscle bellies, and then just slowly ease off the pressure when you get towards that popliteal fossa, but continue towards proximal attachments up towards the top. Okay, if you do find any trigger points in the tissue, then of course treat them. And when we're doing NMT techniques or we're using trigger point therapy, then we'd apply a thumb or a really localized applicator where we find a small region of tension. Remember, the trigger point is going to be hypersensitive. You might well feel or see a twitch response from the tissue, and it will typically give a degree of referred pain as well when you isolate it and locate it. So to fix on a trigger point, we're going to imagine we've got one here, then reinforce your thumb so you're not putting undue pressure on your smaller joints. And a good way to reinforce it will be using your piezoform right on top of my thumb, reinforcing my wrist with my fingers and thumb from the opposing hand, looking after my posture with the back nice and straight, and also my left arm's nice and straight, and then just slowly increase the pressure until we reach a level of discomfort that's about 6 to 8 out of 10. We then maintain that pressure until it subsides, and you can repeat that again 2 or 3 times or until you feel a really palpable change in terms of tissue texture and tissue tone. Just be a bit careful with it because it does cause a fair amount of discomfort for your patient, so make sure you're working within their boundaries and within their pain threshold. Because that's going to reduce tone and reduce tension, then it's nice to follow up with a good stretch. So the trigger point treatment would reduce tension, and a stretch will then elongate the tissues, which is what we're trying to achieve. And shake it out again, make sure the tissue is nice and relaxed, and put a good passive stretch in at the same time. So remember, effleurage, that's going to continue to keep fluids moving, and it's a nice technique to break up more painful techniques. Right, if we find there's an area of excessive tension or a band of tight muscle, then it could be scar tissue, could be just excessive tension, then we can employ a soft tissue release technique. So a soft tissue release technique will target soleus. It's found upon palpation, so trust your hands, get feedback from your partner, and once you think you've found an area of tension, then we can employ a soft tissue release technique. So as to whether you do a passive technique or an active assisted technique, then that's your choice as a practitioner, but the principle stays the same. You put the tissue in a shortened position, so for soleus you want the knee inflection, so it helps to switch off gastrocs. Then we want the foot and ankle in a plantar flex position. From there, I'm going to put a lock in. The lock has to be proximal to the site of tension. So we're going to imagine we've got a tight bit just above here. Now the idea of the lock is to compress the tissue against the underlying bone, in this case the tibia, to prevent further movement proximal to the lock. So I've got a good strong lock in with the heel of my hand, and then to lengthen the tissue I'm going to move into dorsiflexion. And once I feel there's a good level of stretch on the muscle belly, we're going to hold it in that position. Again, getting feedback from your patient would be a good indicator, a good help in terms of when you feel like you've got a good stretch on the muscle. After 10 to 15 seconds, then slowly draw back out the tissue. Relax, put the limb in a neutral position and give it a good shake out just to, again, let the patient relax. I'd repeat that 3 times just to really make a sustained lengthening effect upon the soft tissue which we're targeting. So we're going to go back to our longitudinal techniques, both effleurage with the ulnar border and web space, just to continue to keep venous return flowing and to encourage lymphatic flow. And we can also do some picking up techniques. So if we think there's tension between both superficial and also deep tissues, then picking up's a lovely technique to incorporate. So again, using your hands, using your palpation, I'm going to try and isolate that medial gastroc head and then lift the tissue up and then just mobilize that muscle under my finger pads and thumbs, again just to separate any sort of fascial adhesions that might be present between those 2 different layers. And then travel a bit higher up, again lift up gastroc and just gently mobilize that muscle belly so it's separating it and moving it away from soleus, and the same thing in the more proximal portion of the tissue. So a nice gentle technique that's going to hopefully increase range of movement. Last thing that I think is worth doing to finish off a treatment is to make a good strong sustained stretch. This again would be targeted where you feel there's a reduced range of movement, which you'd find either by objective testing or from your palpatory findings. So to do an MET on soleus, then I'm going to have the knee in flexion. I'm going to move into dorsiflexion until my partner feels a stretch. So if you can tell me when you feel a stretch in there. Yep. Right, what I'd like you to do, please, if you could just push your toes up towards my hand using about 80% of your effort, please. Perfect. 6, 5, 4, 3, 2, 1, and relax. Big deep breath in. And with the out breath, then just move into more dorsiflexion. So when your patient breathes out, they're going to really relax off the limb, and you're going to move into dorsiflexion to increase the stretch. Okay, so if you could push your toes again towards me. So I'm resisting plantar flexion at the moment. 6, 5, 4, 3, 2, 1, and relax. Big deep breath in and breathe out. And on the out breath, I'm then going to move into more dorsiflexion. And we'll do this one more time. Push up towards me. 6, 5, 4, 3, 2, 1, and relax. Big deep breath in and breathe out. On the out breath, then just work towards a new barrier. And that's the final time I'm going to do it. So we're going to hold this in a good, strong, sustained stretch for about 15 seconds. Okay, so we've really incorporated lots of massage techniques to reduce tension, reduce tone, and increase blood flow. Then we've incorporated a good, strong MET stretch just to increase range of movement and also elongate the tissues that we're trying to work through. So you could use all those same techniques in the similar sort of order onto hamstrings or quads, depending on what your target region is.